Hello, everyone. Welcome to our webinar. My name is Victor Vasquez, and I will be your host today. Thanks for signing up and being here today. We'll be talking about key strategies and considerations for improving clinical documentation with generative AI. Now, before we get started, I wanted to throw an important question out there, and I encourage you all to think about the question a little bit and keep it in mind as we talk about our topic today, and then we'll discuss it at the end. The question I want to ask is this: how confident are you that AI can reduce your workload and make your day-to-day life easier? You can throw a percentage in the chat below, and we'll have a tab of that later. Well, as we've already pointed out, today we'll be talking about generative AI as the most modern and advanced language learning model. AI has already made waves, but it is still a mythical tool in the healthcare space. Where it's currently making the most noise is in clinical documentation. Now, we're not talking about word for word transcription here, but structured and organized notes that can save the equivalent of 1.5 to 2 hours of work per day. However, it's important to note that healthcare is a difficult terrain. After all, we're talking about patient data and highly sensitive information. Not only legislators, but doctors, associations, and patients fear the ethical consequences of AI in patient data. For this reason, today, we wanted to take a closer look at how far the technology has matured. After all, it's only been a few months since the technology came into the market, how we can use AI today, and what the future will bring. Today, we have Sridhar Reddy as our guest. He is the CEO and founder of Steer Health, an AI growth and automation platform for the healthcare industry. Sridhar will give us an insight into the current challenges in clinical documentation, how AI works, the ethical implications we need to consider, and what we can expect in the next 1 to 2 years if we expect the technology to continue to mature. We've also invited Dr. Kishori Reddy, a healthcare executive, neurologist, and the chief medical officer of the award-winning Neurology Associates of Texas. As one of the early adopters of generative AI and our in-house software Steer Notes, we're thrilled to hear from Dr. Kishori's personal experience and recommendations on how to best leverage Steer Notes and achieve better outcomes by streamlining your interactions with your patients. Last but not least, we will give you a short demonstration of Steer Notes, to which all the webinar attendees here today will be able to access a free 60-day trial. Now, without further ado, Sridhar, welcome. Thanks for joining and sharing your thoughts with us here today during the webinar. We know you come from a family of physicians, so the first question we have for you is, can you tell us a little bit about your personal experience with clinical documentation?
First of all, thank you, Victor. Really appreciate it. It's my honor and pleasure to be here. I come from a family of physicians, as you rightfully noted, and I've seen a lot of my family members where they spent a lot of time doing clinical notes during and after their work hours. So I'm very familiar with this topic, and really happy to share the kind of like the pain they go through completing all this needed documentation required for regulatory and other things as well.
Yeah, no, that's fantastic. I think that's great. Can you paint a current state of affairs as it pertains to clinical documentation?
Yeah, so I think clinical documentation over a period of time has gone through a major transition. I think, as we all know, the electronic health records, EHRs, became the dominant way of storing and managing all this patient information. And I think that forced a lot of physicians and nurses to really start typing in all these things and making it, the clinical note to be integral part of every interface, workflow, and other aspects. And we all know that physicians often complain about the time-consuming nature of the data entry. Now, along with emphasis on clicking boxes, now they have to really type in paragraphs of clinical notes, right? So it's a really kind of like a lot of changes that happened, but EHR adoption really forced the clinical documentation to be a necessity.
Yeah, so I think you just kind of touched on how we got here with the EHR adoptions. What will happen if we don't take action with clinical documentation in terms of adopting technology?
Yeah, we all know that, in 2022, the American Academy of Family Physicians found that primary care physicians spend an average of 2 hours of EHR, electronic health record tasks, for every 1 hour of direct patient care. That means like for every hour of the patient encounter, they're spending twice the amount in either entering data, reviewing data before, or typing notes. I think there is a lot of data overload, and I think it's very important to recognize that technology can really assist with these things. With the advent of AI and especially natural language processing, I think we have now seen voice recognition at the best, where we can identify and kind of the technology can recognize and convert voice to text. And then AI has now come to a point where with the large language models that it can really facilitate and kind of like augment the content with right clinical aspects as well, and being able to make it more useful, thereby offloading a lot of work from the physicians and the in doing things that they care about, which is patient care.
Yes, fantastic. You mentioned AI. Can we just take a step back and explain what AI is and what its role looks like in the healthcare industry?
Absolutely. So there are a couple of things I want to touch upon. One is really the one part of AI that is really critical in this ambient listening and clinical notes is the voice recognition, speech to text technology. Is kind of becoming almost nearly flawless. So allowing physicians and and patients, right, where we can technology can listen to their conversations naturally. And the second aspect is really around taking the content from these conversations and also making it very structured way of presentation, not only for clinical notes from planning, assessment, and subjective aspects of the conversation. AI can also send patient with actionable, to-do list or task list they can follow through and post visit. So it's a combination of things I believe that are very helpful in terms of bringing how AI can really bring a lot of value to not only clinician but also how clinicians' presence in the patient's home through these patient instructions.
Yeah, no, it sounds very exciting. Sounds like it can provide a lot of improved efficiencies. What would you say would be the best ways to incorporate into the daily workflows here in healthcare?
Yeah, I think the steer, kind of like notes or any AI dictation system where AI transcription really can be helpful is like in ambulatory settings where patients and doctor conversations are happening. And I think this AI kind of ambient listening technologies can not only listen to the conversation but also understand the past medical history of the patient from the records, and be able to provide more comprehensive documentation for the doctor to review. At the end of the day, given the AI models are trained on massive amounts of data, the doctor or the clinician nurse still has to review the final document and be able to sign off on it. I think are the key things.
Wow, that sounds fantastic. Sounds like it's doing a lot already. From where you sit, where do we expect this technology to go if it continues to improve?
Yeah, I think the future holds a lot of promise here in this space. While the current solutions, can capture conversations and do real-time processing and provide comprehensive clinical notes, I do believe a strong future will include I think these ambient solutions will smoothly integrate with other data sources beyond the physician and patient conversations. For example, if someone has a wearable device, I believe that this can be extended into capturing those vital signs and biometric data from patients' wearables and tying it back to this initial diagnosis and findings. So there is a lot of futuristic aspirations around this, but patient-generated data integration, imaging and lab results, incorporating those into the studies, and bringing that conversation into much more holistic patient record, I think is really promising. And then on top of it, I think clinical decision support plays a big role. I think AI just won't passively document things, but also it can also predict certain things based on what it is knowing and learning more about the patient and the use cases. All of this has to be done in very secure and ethical manner. And I think AI governance and also privacy and safe data safeguards play a big role in it.
That's fantastic. Great segue into my next question. If you can, dive a little deeper, are there additional ethical implications that we should consider with AI and clinical documentation?
Absolutely. Considering the huge potential benefits it provides to both clinician and as well as the patient and the overall healthcare system, I think building trust and transparency, and I think to me what that means is really having confidence that the AI models are being used responsibly and is not being used as a replacement for physician judgment. I think AI is really good to augment the powers of the physician clinical judgments and stuff, and not a replacement of it. The second thing is really having a robust safeguards around a rich pool of patient information, and making sure that security and privacy controls are really in place, and the data is not being used for any third party commercial purposes. And last but not the least is, I think regulatory adjustments will also need to be adjusted to make sure that companies and providers are all kind of like protected from these aspects of AI data stores and data providers.
Fantastic. What can healthcare providers do today to protect their patient data?
The first and foremost really is to make sure that their data is not being repurposed. Even if there is de-identified, it doesn't get into hands of other people, other parties. That's a big thing, because I think from the ethical perspective, each individual owns their data. And I think when they go to a doctor, they trust the doctor will be protecting their data. I think one of the first things is to make sure that data protection policies are in place, privacy safeguards are in place, and and the way to really identify these is really making sure that not just a checkbox of HIPAA compliance or SOC 2, but also asking vendors, how they are making sure the data is not repurposed or reused for any other purposes than the intended patient-physician relationship.
Gotcha. Fantastic. And what about any new features in the immediate future in the space of ambient documentation that could impact clinical documentation?
Yeah, I think the very first step here is really to take away that burden for physicians, so they're not taking these notes, dictating patient notes home in the evenings and over the weekends. I think by automating the most tedious parts of this, I think AI notes will free up physicians' time, allowing them to focus on their true passion, which is caring for patients. And I also believe that the second biggest thing is, I think AI will bring in is really between the visits. I think how data can be gathered from various devices, and also passively how it can complement the original clinical note. I think is the second big one. And last one is really around large data sets, and how we can pull analytics from a lot of these things, and aid in physicians' decision-making process, and provide larger trends of how things are happening in healthcare.
Fantastic. Well, we know your company, Steer Health, is an AI software for growth and automation. Tell us about your latest product, Steer Notes. What value is it bringing to physicians?
Yeah, it's Steer Health. Our the reason why we exist is to really empower physicians and their staff, and not to replace them. I think AI becomes a tool, or kind of like a ability to amplify the productivity of our physicians, their staff, and the nursing departments, is how we look at it. Our Steer Notes really is one of the excellent additions to our product suite, where we have done amazing technology innovations around discrete background recording. We securely record patient-physician conversations using advanced audio processing, and our security controls and privacy safeguards are second to none. We will never compromise our data. We never commercialize this data. We protect it to the fullest extent possible. And then I think our AI engine also is one of the most advanced. It has over 35 specialties we support, and which is helpful in identifying key medical concepts, potential diagnosis in various areas. So really excited for it, and looking forward to serving more doctors, more of the healthcare organizations.
Fantastic. Yes, very exciting indeed. Thank you so much for your insight, Shradar. If anyone has any questions for Shradar, I invite you to leave them in the Q&A box down below, and Shradar will be around to answer them for you shortly. As a lot of you may know as well, we are offering a free 60-day trial of this product, Steer Notes. In the next part of the webinar, we're going to give a short demonstration of our standalone Steer Notes product, which means you don't have to be an active Steer Health partner customer to take advantage of this free trial. For those that are active customers, I'd recommend reaching out to your customer success manager, scheduling a demo to see what Steer Notes could look like turned on within the platform. What we're going to show you during the demo is the quality of the output. So you'll not only be able to see the accuracy of the transcription, but also how AI has summarized and has composed the clinical notes. Thank you again, Shradar, and here we go.
Thank you.
This is the simplified version of our Steer Notes platform. For those of you that will leverage our platform without an EMR integration, what we'll recommend is to upload all of your scheduled patients for that given month, that given week, or that given day by selecting the Upload Appointments button here. For this example, we're going to manually add in our patient, who is Jessica Jones, a fictitious patient. I'm going to go ahead and add her details on here, and she's visiting me, an orthopedic doctor, because she has knee pain. As soon as the patient is in your exam room and you are ready to start your patient visit encounter, all you will have to do is select this blue button here, which I will do now. Good morning, Jessica. Come in, have a seat. How's your husband doing?
He's doing great. Thanks for asking.
I heard that he got a new job. Is that right?
That's right.
Wonderful. Now tell me, Jessica, how can I help you today?
Thank you, doctor. I'm here because I've been having some pain in my right knee for the past week.
I'm sorry to hear that. Can you tell me a little more about the pain? Where exactly is it located and what kind of pain is it?
It's right on the front of my knee, just below the kneecap. The pain is sharp and stabbing most of the time, but sometimes it feels achy.
I see. Okay. Have you noticed anything that seems to make the pain better or worse, Jessica?
It definitely hurts more when I try to bend my knee all the way, like when I go down the stairs. Putting ice on it seems to help.
Is there any recent injury or perhaps an activity that you can think of that may have caused this pain?
Yes, actually. I fell down the stairs at home last week and landed right on my knee.
I'm sorry to hear that. Well, to get a better understanding of what's going on, I'd like to do a physical examination of your knee. Based on what you've described in the examination, I suspect that you may have a sprained ligament in your knee. However, to confirm this and rule out any other injuries like a fracture, I recommend getting an X-ray.
What does an X-ray involve?
Yes, it's a quick and painless imaging test that uses a small amount of radiation to create pictures of your bones. It will help us to see if there are any cracks or breaks in your knee joint.
Okay, I'm willing to do the X-ray.
Great. We can schedule that right after your appointment with me. In the meantime, to help manage the pain and inflammation, I recommend the following. Rest. Avoid strenuous activities that put a lot of stress on your knee, especially for the next several days. Ice. I want you to apply plenty of ice for about 15 to 20 minutes at a time, several times a day, and wrap the ice pack in a towel to prevent skin irritation. And compression. You can use compression bandages or sleeves to help reduce the swelling. And then lastly, pain medication. Any over-the-counter pain relievers like ibuprofen should help with managing the pain and inflammation. Please follow these instructions carefully. I will also be able to give you more specific guidance on these recommendations after we see the X-ray results. We will schedule a follow-up appointment for 2 days from now to discuss the X-ray and determine the best course of treatment for your knee. Now, Jessica, is there anything else you'd like to discuss today?
No, I think that's all for now. Thank you, doctor.
You're welcome. Don't hesitate to reach out if you have any questions or concerns before your next appointment. Once your visit with the patient is done, as you can see, you're going to end the recording. Here we have the entire transcription word for word. And here is where the Steer Notes product takes its magic. We're going to check the little box here. And you can select which kind of format you want your note to be created. For this example, we're going to go with our standard SOAP note and select the Generate AI Steer Notes button at the bottom. And in a matter of seconds, what once used to take most providers anywhere from 5 to 15 minutes will take us less than 30 seconds to have our clinical documentation, our clinical note created. As you can see, our SOAP note was created with the subjective. It was able to identify the patient, her age. We could see the objective. We could see the assessment and the plan that I, the provider, the orthopedist, has for my patient. On the bottom right-hand corner, we have our hamburger menu. When I click the menu options, should you decide to integrate this standalone product to your EMR, you'll be able to select push to EMR, and with one click of a button, it's going to flow directly into your EMR. If you want to generate patient instructions, you can click this generate patient instructions button, and it's going to generate all of the instructions that you have verbally given to your patient through our AI platform, and it's going to allow you to text the instructions to your patient. Here are the instructions for my patient, Jessica, along with the follow-up instructions. The Steer Notes platform is going to pull her contact information, and we're able to send the instructions to our patient. If we go back to our hamburger menu, you're going to see that you can also edit the notes. So if there's something missing that you may be wanting to add, you can go ahead and come in here and free text any additional information. We go back to our menu options. We can even generate the CPT codes, and we can copy the notes and pull them directly and paste them into your EMR for those of you that are only looking to use Steer Notes as a standalone product. Now we'll move on to our discussion with Dr. Kishori Soyam-Reddy, who is the first physician to leverage Steer Notes in her private practice.
Dr. Kishori, thank you so much for joining us today. You are the practice owner and the Chief Medical Officer of Neurology Associates of Texas. We'll start with an easy question for you. How long have you been practicing as a neurologist?
Thanks, Victor. Thanks for having me. I've been practicing for 14 years, so it's been a long time.
Fantastic. Can you walk me through what was your process for clinical documentation before you adopted Steer Notes?
Yeah, so before Steer Notes, my process for clinical documentation was incredibly time-consuming. I spent significant portion of my time in taking notes during patient's visit and then dictating and again editing. So it was very time-consuming, inefficient. So I'll re-say that. Sorry, it was inefficient and led to delayed documentation, unfortunately.
Gotcha. Yeah, that's what we hear on our daily conversations. Now, did you also have a staff member sitting in the room with you, transcribing or doing note taking in your clinic?
No, I haven't used my staff members or scribers. In fact, I utilize transcription services, and also there's a newer technology where it's Fluency Direct, which has been great that I can directly dictate into the patient's chart. However, I still have to recall all the discussions that we had with the patient and do a little bit of editing. It does capture a lot of medical terms, but it's nothing like Steer Notes, for example.
Gotcha. Yeah, I'm sure having to recall the encounters is a lot of energy spent on your behalf.
That's right.
Would that work? Go into the evenings at night times for you?
Mm-hmm. Yeah, unfortunately, I've spent like 1 or 2 hours every evening just to complete the patient's notes. Given the complexity of neurological disorders, I spend a lot of time discussing with the patient the plan of care. I know some providers do transcribe or type during the visit, which is great. But in my situation, I tend to spend more time with the patient and kind of put the documentation to a later date. However, that sometimes can delay the patient care. So I try to prioritize my patients that would need a lot of images or tests sooner than later. So I kind of go by, and of course, with all other responsibilities that I have, with the call, hospital call, and between patient messages and all that. So dictation becomes my, okay, I can do this in the evening. So yeah, typically been spending 1 or 2 hours. Well, with Steve Notes, that's not the case.
Gotcha. Yeah, they're keeping you busy now. I'm glad Steer Notes is helping you out. You mentioned using previous tools in the past before Steer Notes. What did you like or dislike about the previous tools before Steer Notes?
Sure. Yeah, obviously the transcription services, they transcribe what they hear, understand, and then I still have to edit on top of it. And with the recent one, I still have to dictate through it, and I have to recall all the events or discussions that we had during the patient's visit. So it's kind of recollecting all the memories. However, with Steve Notes, during the patient conversations, it captures everything in real time and accurately. So all the information is captured. We are not missing any patient history or anything related to that. So which is a huge benefit. And more than that, I think it improves patient focus, care, and the Steer Note summarizes very nicely and basically like medications, orders, labs, MRIs, whatnot. And that can be followed through by my staff after I finish the notes. And before the patient leaves, Steer Notes provides full patient instructions related to the conditions, which is a significant value for the patients to follow through on it, and also for my staff to go through and make sure all the tests and orders have been taken care of, which has been a benefit.
That sounds fantastic. Sounds like you were juggling a lot of different components, and with Steered Notes, right, it's been able to help your office be a little more efficient.
Absolutely.
Where do you see that's great. Where do you see the AI capabilities like Steer Notes can bring the most value for more clinics that are very similar to yours?
I think the most value is collecting large data from all the patient information, diagnosis, and the protocols, and the way, of course, a lot of times providers have different ways of utilizing medications and all that, but it gives much more information on what are the medications most effective, what are the tests are needed for certain diagnosis. So the large data collection in helping patient care, and also for research, right? Medication research, or those are the huge benefits. And also, in addition to that, the messaging systems and following through on patient care. I think this is going to take to a different level. Of course, AI is not going to replace human intellectual capacity.
Yeah, awesome. That's fantastic. And what's getting you most excited about the future of technology in healthcare?
I think technology has been so much valuable lately. I think better communication with the patients, faster communication. And of course, with Steer Notes, the patient's physicians' burnout has been reduced significantly. So you're not spending 2-3 hours. I would rather spend time with patients than sitting and documenting these notes. So I save a lot of time, and I could see more patients, provide, obviously faster care for my patients, definitely.
That's fantastic. So the faster care for your patients. Is there, one last nugget that you think generative AI can contribute to the healthcare industry?
I believe so. I think, as I said, it helps to collect more information, and obviously the research area would be more utilized, and we will learn more about, as I think our patients now are able to utilize a lot of these AI related systems, right? And also patients respond better to text messages. Of course, that can create, care gaps, and also help the patients to follow through. And it's easier to get in touch with them. So I think, in my opinion, I think this has been a great addition. And of course, the newer providers that coming out of schools will adopt much more than our generation, but I think we're getting there. This is great.
That's great. Yes, it is a new age in healthcare. Well, this was wonderful, Dr. Kishore. Thank you so much for sharing your experiences. We know you're a very busy individual provider. Again, thanks for joining us today. If the audience has any questions for Dr. Kishore, feel free to add the questions in the Q&A box below. We'll make sure to have those questions answered for you later today.
Absolutely. Thank you so much for having me. It was great talking to you, Victor.
We'll now be moving on to the Q&A portion of our webinar, where we'll have about 5 minutes to answer questions from the audience. I will also invite Sridhar back on stage. Sridhar, welcome back. Thanks for joining again.
Hi,
Looks
good to
like
see
we
you.
have a couple pretty good questions from some of the audience members. We'll start with this one for you, Sridhar. Does this tool, Steer Notes, have the capability to accurately transcribe and understand different accents or languages?
Yeah, great question, Victor. And I think, in terms of like the languages, it supports over 12 languages today, and we're adding more models behind it. For the general release GA product, we only have English at this point, but we're doing other work in the behind the scenes. In terms of accents, we use one of the most advanced language model, and the voice to text, which is the key part of it, is very sophisticated, and we have tested multiple angles and accents and have worked really well. Really can confidently say the language listening aspect of AI has improved tremendously from the last, I would say, the last decade or so.
Fantastic. Thank you, Sridhar. We have another one from, looks like, audience member named Varun. How do you get veteran physicians on board who are used to writing their notes and trust what they have written versus what a machine is writing for them?
Yeah, it's a great question. I think, physicians have been pushed a lot of technology into their workflows, and I would say more into their throats by a lot of regulations. And I think there are still physicians who write clinical notes on paper. I do believe the thing I would ask them is, like, if they can just leverage and kind of adopt a technology like Steer Notes, it not only frees up their time, from jotting down notes after each patient encounter, but also, I think, provide a much more better quality of patient instructions as well post visit. We all know as patients, we get very anxious, when you're in a doctor's office. And I think when you're leaving, if the system can really deliver comprehensive action list that you can follow through, and not only the doctor doesn't have to write notes on paper, but also is able to provide extended care to the patient when they're at home, I think it's a huge value. And our team here, we are very well equipped to onboard the staff and the physician extremely, kind of like training them. And our technology is extremely easy to use. I think between those two things, I think we should be able to help these doctors that have been resisting technology changes and bring them to the, the age of Steer Notes.
Fantastic. Thank you, Sridhar. Sounds like a no-brainer if I was an audience member there. We have another question here from Riley. Do we need any specific software or app to use Steer Notes during the trial period?
Great question. We built a lot of our technology with the users in mind, where they don't have time to download. And we all know, as smartphone users, how the download process can be pretty tedious. So we use security built in, so you can use our Steer Notes from any browser that you can access securely, preferably Chrome or Microsoft Edge, and you should be able to leverage it right from there without any additional software downloads and any of that stuff. And we have extremely tight controls around security. You can dictate how many days the note should be stored within the system. So we have a lot of controls and privacy. So we want to make sure that the data belongs to the provider and the patient, and not for any companies or third parties.
Great. I think that's a perfect segue into what I think is a very important question from one of the audience members is Steer Notes HIPAA compliant? Can you dive into that for us, Sridhar?
Yeah, sure. We are a HIPAA compliant and also SOC 2 verified company, and we take security controls extremely serious. And when I say that, the time the data is coming into the system, we protect them in flight. We do not share this data with any third party. We ensure that data is in a transient state for the time that is in the system. and the customer can define that those days that it should be on there, and then we make sure that the data gets cleansed after that. So think of it like, the Snapchat type of thing, where you have clear rules around how many days the notes can stay. And once the data gets into EMR, we just kind of make sure that's gone. So the beauty of this is, our entire platform is we help acquire patients and make sure they can schedule appointments. Now, this data, we know about the patient's historical medical information. And now by enriching that with the clinical note, we're able to provide that comprehensive documentation. And the length of the documentation, really, how long we store, is a function of what the settings are.
That's fantastic. And I'm sure a lot of the audience members appreciate that there. Well, thank you, Sridhar, for answering some of these questions here. Looks like that's it for our time here today. We thank you all for joining our webinar. If anyone has any questions for myself, for Sridhar, or Dr. Kishori, we're going to add our URL profiles to LinkedIn. Feel free to connect with us and shoot us any messages. Thank you all.
Thank you, Victor. Thanks, everyone.